My name is Dr. Cory Jones. I work in pediatric gastroenterology at Prisma Health. The way I like to think about pediatric gastroenterology is it is a study of food all the way from the time you eat it until it's eliminated. And we deal with all of the diseases and processes that happen to that food from the time you eat it until it's eliminated. Food is a really important social thing for all of us, and I think that it's really exciting to help people be able to partake of that and to overcome the barriers that are causing them either pain or difficulties eating or things like that. On the other hand, the other thing about gastroenterology is that elimination is also something that's very socially awkward and difficult socially, and so sometimes when you have people who are struggling with elimination of their food or elimination of their bowels, being able to help them so they can thrive in school or thrive in work or other places where elimination becomes a problem, I think is really exciting. I remember a patient that I had a while ago, and her goal was to eat a cinnamon roll at Christmas time. And I remember she had really complicated disease, she had to go through a bunch of surgeries and things like that, but eventually, come Christmas time, she came to clinic and we bought her a cinnamon roll. And that was just like such a great experience because that was her goal, that was sort of her summit to climb, that was her mountain to climb, and we were sort of able to help her get from the beginning of that process all the way to the end. Things that make me really excited to do my job are, I love it when patients come back and they're better quickly, especially. I don't think there's any better feeling in the world than being able to take a patient who comes in with abdominal pain, for example, diagnose them, and then when you see them next time, they're completely better, and they comment on how much better their life is. So as much as we deal with chronic diseases and we like to work through those and get people to long-term goals, I think the ability to take somebody who is disabled by pain and turn them around almost immediately is probably one of the most exciting things that I do. Outside of medicine, I really like to do anything that I can do to get outside. So I like to fish and I camp. I do a lot of hiking, I do a lot of woodworking, and so anything that I can do to sort of get outside and work with my hands and do things like that is what I really like to do. If you'd like to make an appointment with me, please ask your pediatrician to put a referral in.